Well, good morning, Miramar, and welcome to the show. Thank you so much for watching. Don't forget, you can check us out on all of our social media. We're on Facebook, Twitter, and Instagram at City of Miramar. That's Miramar. And we all know it's right here in Miramar. And right here with me is Commissioner Alexandra P. Davis. She is bringing something else to the city. And this one sounds like it's going to be a lot of fun. Gospel Groove Sunday.
Absolutely. So Gospel Groove Sundays is an event that I started a few years ago. Of course, with COVID, we had to forego it last year. However, this year we're back again, and we're having our guest, our Stellar Award nominated guest, the Williams Singers, who will be our headliners.
And I know about the Williams Singers, so they're going to be great. And then you also have a comedian that is going to be on the show too.
Yes. Well, one of the things behind the comedian, by the way, this has been being done in conjunction with Azores Foundation. And they have a different theme every time they do these events. And this theme is to bring awareness to mental illness. And so they figured that this would be something lighthearted, and they would have a comedian to help lift our spirits, because laughter, of course, is almost like food for the soul. So Natasha Calloway will be a comedian, and she will be present. She'll be showing us her talent, of course. And we'll have some local artists as well. So we have Worldwide Worship. They will be performing. We have New Seasons Worship Center, who will also be performing. We have a testimony given by Dr. Antoine Thurston. And so it's just going to be a whole good event, a wholesome event. We want folks to come out because it is free too.
Which is always a great concert. Gospel Groove Sunday, this coming Sunday, July 17th from 6 to 10 p.m. at the Miramar Cultural Center. Something that you did mention, Commissioner Davis, was that, it had to be postponed last year because of the pandemic, and we couldn't get together. And now that we are able to get together, but also that Azores Foundation is going to be tackling mental health, which a lot of people either got in touch with their mental health during the pandemic or it got worse during the pandemic.
Absolutely. And so we didn't even realize the effect that it had on our children and on adults, being thrust out of their normal activities, many into isolation. And so we wanted to bring some awareness. We'll be collecting a donation that goes towards an organization that helps with mental illness through the Azores Foundation, which is a 501c3. So it's for a good cause. Again, it's this Sunday. It's going to be held at our Miramar Cultural Center at our banquet halls, and that's 2400 Civic Center Place from 6 to 10 p.m.
So a great Sunday evening concert. Again, Gospel Groove Sunday, a spirit-filled concert. It's going to be a free event. And there's also going to be vendors and food trucks, right?
Absolutely. So we'll have a couple of food trucks out there, vendors who will be selling various novelty items, T-shirts and things like that. And for folks, we'd love for you to register. Even though it's a free event, we do like to find out how many people will be attending. And so to register, you would go to gospelgroove22.eventbrite.com. Once again, gospelgroove22.eventbrite.com.
Okay. And of course, open to the public, open to everyone in Miramar, open to South Florida to come and have this Gospel Groove Sunday.
Absolutely. And we're going to have a very good old gospel time.
Hey, some hand clapping and some feet stomping. Trust me, I know, especially with the Williams Singers, that's going to be really good. And I just love the fact that when we do these events, and particularly the ones that you do and the other commissioners, some kind of way people from other municipalities find themselves in Miramar.
So true. We want to be that city that folks want to come to, and hopefully they want to come and they want to stay.
There you go. There you go. All right. Well, you can come and stay on Sunday night, the Gospel Groove Sunday. It is a free event, spirit-filled concert happening Sunday, July 17th, 6 p.m. to 10 p.m. at the Miramar Cultural Center, 2400 Civic Center Place, right there next to City Hall. Again, comedian Natasha Calloway will be there, as well as the Stellar Award nominated the Williams Singers. It is going to be truly nice, and bring the entire family. This is open to all age groups.
Absolutely.
All right. And don't forget about the vendors and the food trucks too. So just a evening of fun and, praise, worship there. The Gospel Groove Sunday Spirit-Filled concert this coming Sunday night, July 17th at the Miramar Cultural Center, right there in the banquet hall. Thank you so much, Commissioner Davis, for all that you do. And thank you to Anzora's Foundation for you partnering with them, and that they are dealing with mental health issues this year. That is their focus. So thank you so much for partnering with them on that. Good morning, Miramar, and welcome to the show. I'm your host, Tamara G. We all know it's right here in Miramar, so don't forget to check us out on all of our social media. We're on Facebook, Twitter, and Instagram at City of Miramar. And today we have a very special guest from one of our wonderful community partners, Memorial Hospital. But we're going to be talking about something that's very serious and is happening not just in South Florida, but around the country. With us today, we have Alberto Ogston. He is a doctor of pharmacy. He also is a board certified clinical toxicologist. And we're going to be talking with him today about the fentanyl crisis that is happening in our communities right next door to you. You just don't know it, but it's happening everywhere. So welcome to the show. And Dr. Ogston, how are you?
Good. Thank you for having me, Tamara. I really appreciate it being here.
No problem. So, as a pharmacy clinical manager and as a board certified clinical toxicologist, just put into words what it is that you guys are seeing at Memorial Hospital. And it's not just at Memorial's, at every hospital in South Florida, but, particularly your hospital.
So let's go over some trends that we're seeing nationally. And whenever we speak of trends, I think it's important for the folks tuning in to understand that we're really working in the past. There's a lot of information that takes time to get to us. And by the time it gets to us, it's really old data. And what we saw prior to the pandemic, and we have been seeing, was a steady rise in what we call fentanyl use and fentanyl-like analog use. And fentanyl is essentially a very strong opioid. It's considered to be 50 times stronger than heroin, 100 times stronger than morphine. So it's very powerful. With that being said, fentanyl has a use in the medical community. We use it for patients who have severe pain. We may use it in surgery. But obviously in this instance, it's being used illicitly. It's coming and it's being put into our supply of different opioids. It's being put into our cocaine supply. It's being put into any pressed pill. So whether you have a pressed pill and you're purchasing it, something like Xanax, which folks may get off the street, or you even try to get a pain pill off the street, it turns out that many of those are showing up with fentanyl in it. And with that being said, you can imagine what I just mentioned, how powerful this product may be, that a small amount can kill you. And there's a campaign we're going around and promoting and ensuring the community is aware that one pill can't kill. And that's actually very true. There's an old saying that we used to say to our kids when we were younger. Even my parents used to tell me that, and you would just shake your head. But that's the truth. That's really accurate in today's day and age.
So just
and what we saw, go ahead, Tamara.
I was going to say, so just taking one pill could kill you.
Absolutely.
Why would people take that risk? Or do they even know that they are taking fentanyl?
So to your point, no, they don't know. And if you look at the data, there's a few data points I'll mention to you. The first being that we now have a rate related to fentanyl deaths in our youths, younger than 18. This is across the country. That equates to more during the same time frame since the pandemic than COVID itself. So when we were so concerned about COVID, which we should have been, we had more children under the age of 18 dying from fentanyl-related overdosing versus COVID. So now we're seeing this, it's affecting our youths, it's still affecting our adults. Mm-hmm. And when you look at our own community, our own hospital, we have amazing programs in place, and we've been running them since 2015 with excellent results. And what we're seeing now is we're still seeing a huge influx of patients. This last weekend alone, we saw in just a 24-hour period, probably, I would say a 300% increase in folks coming in with fentanyl-related exposure, secondary to using cocaine. They weren't even seeking to use fentanyl. So it's concerning. And so why would they use it? Well, they're trying to use something else and they don't know it's in there. And that's what we saw. 85% of the deaths associated with folks with fentanyl were people who weren't trying to use fentanyl. They were trying to get their hands on something else.
Right. And I was going to
So
say, so
now we're
there's no,
educating.
yeah, so there's no honor among thieves because, you know, as a drug dealer, why would you put something in the product that could actually kill your client? That just doesn't make any sense. And then why would someone take it and not know that it's in there? Like if I knew it was in there and I know that it can kill you if you just have one pill, I'm probably not going to take that.
Exactly. And that's the message we want to send to our community, especially our children, because you can imagine our children, they're more vulnerable. They're not, for the most part, the majority are not experienced users. They haven't used strong opioids. They haven't used heroin. They haven't gotten their hands on these strong products. So they're even more susceptible to taking a pill that has enough of fentanyl in it that can kill them. And that's really the message, just to have that understanding that you're really taking a gamble. It's Russian roulette. When you're taking that pill, you don't know what you're getting your hands on. It's really dangerous.
If you're just tuning in, thank you so much. We are having a very important discussion because of what is happening around our community. And the fact, Dr. Augustin, if you are also just tuning in, he is the Memorial Regional Hospital Pharmacy Clinical Manager. He's also a board certified clinical toxicologist. We're talking about the fentanyl epidemic that is going on around the country and here in South Florida. So over just one weekend, Memorial saw a 300% increase. That is amazing that there are so many, particularly when you said young people that are using. Are they just experimenting, or are they, you know, trying to find that next high? Because do you normally start off with pills? I thought everybody started off with weed, but I don't know, because, you know, I haven't even done that either. So
yeah, and I can speak to that. And there's a survey that's been surveying our youths for over 40 years, and they take a survey across the country and they look at trends in use of marijuana, like you're saying, pills. And those numbers have been consistent over the last 40 years, and meaning folks, children that jump into marijuana, and then some of them that try other hardcore things, cocaine, pills, and so forth. And I think the problem is that we're seeing two groups, and it's very important to distinguish. We're seeing a group of young folks, younger than 18, that have an addiction to opioids. And if you think about it, that's challenging, because opioid addiction doesn't develop overnight. Typically, it takes months to years to develop that. So that means if we're seeing children at the age of 17, we've seen plenty already, who have an addiction, that means they've been using some opioid for a period of time, many times years, starting maybe at the age of 14. Many of these folks prescribed it early on for a procedure, a needed procedure that maybe had significant pain, but it led to something further. And those folks were able to treat them, and we're starting to treat them in our program. So we're seeing individuals very young coming into treatment, and we didn't see this before. Then you have the entire new group, which is the fear factor right now. These are the group of young individuals that are trying. It could be a party, it could be the end of the year party, it could be a July 4th party, and the summer party coming up now, and saying, you know, we're experimenting, and somebody takes out something, oh, it's a Xanax, something maybe you want to use to relax. But it turns out that those things now have fentanyl in it. So that's that problem, that you think it's one time. It could be an amazing child you have, somebody that's, you know, on the honor roll, they're educated, they're staying out of trouble. And it's that one decision at one time, which you've seen, that's led to very serious consequences, in many cases, death.
right. The one that reminds me right now of what you're just saying was, I believe this happened at the end of the school year. The group of kids, and I say kids, college students who came in from West Point. I think they were in Fort Lauderdale, and they were had rented an Airbnb, and everybody got sick, including the ones that didn't do the drugs, because I think they tried to give the sick ones mouth to mouth. And turns out it was something laced with fentanyl. They didn't even know it.
Yes, exactly. And that's the thing. So, and I think that now that we're seeing it in our youths, and as parents, I'm a father of 3 children. We speak to them, we talk to them, we warn them. The education is the most important part, talking to them about it, because we know that many times they're going to make decisions, they're going to be impulsive, and we just want to make sure that they're aware of the consequences, because this can happen. It could be a party environment, it could be peer pressure. We just want them to know that this is a real threat.
Okay. Now, is it that if you use fentanyl that you are going to die, or, obviously the chances are extremely high that you will, but can you recover from it?
No, so it's all based off of a quantity and really the way your system is accustomed to an opioid. So if you have somebody that's a frequent opioid user, they could probably handle a higher dose. Those that don't have that experience, then a smaller amount can cause more problems. And when I would say problems, you have to understand that fentanyl, and like any opioid, acts on what we call opioid receptors. And when you ask what's an opioid receptor, it's basically something that receives that molecule in your body and does something. So naturally, you would imagine if you're taking an opioid for pain, there are receptors that treat pain. And that's the reality. That's how they're supposed to work. But unfortunately, there are other receptors that do other things. And I'm sure many of the folks that have used opioids know one of them is there's a receptor that can slow down your GI, your gastrointestinal tract, which in effect causes people to get constipated. The other impact it can have is an area in the brainstem, which controls your breathing, respiration. So as you activate that receptor, your breathing slows down. Well, if you activate it too much, that breathing slows down to the point of you can actually stop breathing. And that's where overdoses come from. And that's how people die, because their breathing stops. If your breathing stops, you're not oxygenating your heart, right? And eventually you go into cardiac arrest. And that's the fear. And one of the things to point out is what we're seeing is that folks who have died from fentanyl overdose, fentanyl exposure, it's a much more rapid and quick death. Meaning in sometimes past before fentanyl, if somebody had an exposure to an opioid, or let's say heroin, you may have more time while they're down to a system than what we're seeing now with patients with fentanyl. And one of the things that we use to reverse an overdose is something called Narcan. I'm sure many of the folks on here have seen that there's advertising about these things called Narcan kits. We use Narcan, which has an active component called naloxone, and it reverses that overdose, and it's given intranasally on scene.
Mhm.
And these are kits that we're actually at Memorial and many places across the country, we're giving away for free. We're giving away to individuals that have potential risk for addiction, and we're giving them away for free to actually family members that believe that maybe some loved one may have a risk of addiction. So something to really consider if there is a potential for somebody to be using opioids that you may know.
That's amazing, Dr. Augustin. So you could just go to Memorial and ask for the Narcan?
Yes, so we have a MAP program, which is called medication assisted treatment. And we have a program that allows and provides these kits for free to these families. And if there's anybody interested, we can go ahead and provide you a link with information on how to get more access to that.
Okay. And is it for adults as well? Like if there is an adult who has an opioid?
Absolutely.
Okay.
All of this started originally to target the adult population.
Mhm.
Obviously, now we're seeing this affecting our under the 18 years of age, hence why we've now expanded it. But really, it's originally intended and started for the adult population.
If you are just tuning in, thank you so much for watching Good Morning Miramar. We are speaking with Dr. Alberto Augustin. He is a doctor of pharmacy at Memorial Regional Hospital. He's the pharmacy clinical manager and also a board certified clinical toxicologist. We are talking today about fentanyl and how it has infiltrated the South Florida community, and not just South Florida, around the country, the opioid epidemic. Now, fentanyl also came into play. The first time I ever heard about it was with Prince. And so Prince has been dead now. I think it's been 4 years or 5 years. I had never heard of fentanyl before then. And first of all, most people still can't believe that he died of a drug overdose, because they said he led such a clean lifestyle that, but they also said he had hip problems and was taking the drugs to help with the hip issues. So you're right. It may start off, the opioid addiction may start off because you are truly working on, getting over some pain, but you become addicted. How does that happen?
So it's a great question, and it's a complex response. So I'll try to simplify it. There is an area of the brain called the reward pathway. And the reward pathway is exactly what you're hearing me say, reward. And it's a pathway.
Makes you feel good.
Makes you feel good.
Okay.
And what's the reward for anything that we do? And you can think of basic things. How about exercise, eating, getting some good sunshine, listening to great music, and a piece of chocolate cake. The reward is a release of something called dopamine. And many folks are aware of what dopamine is. Dopamine is a neurotransmitter. It's a chemical released in your brain. And it makes you feel good. It makes you feel happy. It makes you feel, a good term we use is euphoric, elated. It's a feeling of well-being. Well, it turns out that drugs of abuse, any drug of abuse, activates the same pathway. And by activating that pathway, you start having release of dopamine. And essentially what happens is that pathway then creates a reinforcement, which is you now create a pathway which you recall that well-being. You say, that feels good. And you cause this reinforcement to say, I want to keep doing that. I want to keep doing that. And it relates to anything in our lives. It's not just people who have an addiction to fentanyl. We have addictions to many things. We have addiction to food, and there's an obesity issues. We have addiction to gambling. We have addiction to sex. We have addiction to pornography, all types of addiction. So it's not, we like to hone in on this particular community, but many of us listening have addictions from even smoking cigarettes, nicotine, caffeine. And there's this reinforcement that occurs, and it causes this release of dopamine. It's just a cycle. And it's very challenging. And it leads to a psychological addiction. Hence, the beauty of a program like ours, our MAT program, medication assisted treatment, in which we focus on the psychological aspects of addiction, giving the individual an opportunity to be able to come off the drug they're using and deal with the issues at hand. The psychological pieces could be multifactorial. You can develop a depression, you develop an anxiety disorder, and you can understand that having these different psychiatric disorders then creates an episode, an issue related to, I need to help with that issue that's going on, whether it's depression, anxiety, and I cope. When I cope, I use something that makes me feel good, activating the reward pathway, releasing dopamine, and it creates that reinforcement. So breaking that chain of psychological addiction is extremely challenging, but understanding that it really comes from an area of the brain as very basic, right? It's very animalistic from us from the beginning of our creation. Understanding that tells you that there is work that can be done, but it takes treatment to get there.
Okay. As a board certified clinical toxicologist, you have seen, I'm sure, everything, Dr. Ogston, when it comes to addiction, particularly when it comes to drug addiction. And, there are people who, it's the debate that's been going on forever that, we'll just say marijuana, medical marijuana, whatever you want to call it, is a gateway to possibly doing harder drugs. As a board certified clinical toxicologist, do you see that in your practice?
So it's a very challenging question, because it's the debate, like to your point, is we've had for generations. Mm-hmm. From my perspective, whether you believe it to be true or not, I don't believe it to be true, but whether you believe it to be true or not, the rates of marijuana use have remained steady, over 35% in our high school kids for decades. And many of the folks that are listening, especially those that, it's been 20 years since your high school reunion, whatever it is, that that's something that many kids did. It didn't necessarily mean that you were going to end up using some of the harder agents. Now, What I would tell you is we still have an issue at hand, and the issue at hand is whether you believe it to be true or not. Marijuana is available medicinally, meaning it's medicinally approved in many states.
Mhm.
Now it's actually approved recreationally in many states. So it goes back to now you have something, whether you believe it to be a problem or not, it's available, high accessible, just like alcohol is. And we know alcohol, right? Inappropriate use of alcohol is problematic. And actually, we have a significant rise in alcohol use in this country, especially post-pandemic.
I was going to say during the
Significant.
pandemic, a lot of people drank a lot at home because they were at home with their families, which they normally
Yes,
aren't. They didn't have jobs and they just drank and drank and drank. The liquor stores couldn't keep liquor.
exactly. And so it would be foolish to not know and understand that we do have an issue regardless of our agent of choice, meaning if you're using marijuana
Mhm.
for purposes, and what are the purposes? To treat some anxiety you have. Or you treat, what is it? Alcohol, what are you using it for? Is it socially, or at this point, is it now because you can't sleep at night? You need to sleep, or is it because you have anxiety or you're lonely? No matter what it is, understanding at the core that we're basically self-medicating with these substances. And the question becomes, does it become a crutch? Does it lead to other things? That's one issue. And the second issue is, does it lead to other medical related issues, right? Heavy opioid use can lead to death. Heavy alcohol use can lead to liver issues, hepatic issues, cardiac issues, right? So these are the questions that we have to ask ourselves. And that's why I said it's multifactorial. There's so many factors involved.
All right. Well, obviously, you guys have done the research and you see it on a daily basis. I think is, you have a firsthand experience of what people go through when they come to see you guys. And speaking of that, how can someone get in touch if they feel that they have a family member that has a problem, or if they know that they are having a problem with drugs?
So there's two ways I would recommend. The first, if you are interested in contacting our system, and you can reach us at 954-265-4632, 954-265-4632. That's our MAP team program number. But the other access point is the 211. Believe it or not, our 211 can provide you excellent resources, and they have done a really good job at compiling community resources outside of Memorial. It's just that you may have access to Narcan kits, access to treatment programs, inpatient and outpatient. So that would be my recommendation. If you truly want our program, you can recall that number. And if you're interested in general information, 211 is a great place to start.
Okay. So again, the long-acting therapy clinic, the number 954-265-4632.
Correct.
Okay. And
that's for the
then
MAP program.
the
Right.
MAP program. And tell us once again about that, because I think it's very important if there are parents that are watching this right now, or any adult who is suffering with opioid addiction, to know that you can get Narcan and you can get it for free because it may save your life.
So yeah, so that number, that in line, and would give you access to our folks who manage the severity of the cases. Meaning, let's say you have the worst case scenario, somebody in active use, somebody at risk for overdosing and dying, and or actively withdrawing, because when you stop using opioids, you go into withdrawals, which is extremely uncomfortable. And patients should be aware that if that is you, we have immediate access to help manage that, meaning our patients will receive treatment within 24 hours. You'll be feeling much more comfortable in that process. And that's extremely key into helping them succeed. So that's for the acute. Now they can triage and determine you are not acute. And guess what? We even have programs for those that don't have an opioid addiction. It could be cocaine. It could be old school flakka, which affected our community years ago. It could be marijuana, to your point, alcohol. And we have programs for all of these things. And those folks can help tier you and say, this is the recommendation, and we're going to send you to our outpatient or whatever program fits the needs. And if you need access to a Narcan kit, provide that Narcan kit free of cost.
Okay. And another thing too that may contribute to people maybe not coming and seeking help, not that they don't want to get off drugs, they may feel like they can't afford it because, of course, getting therapy or being in rehab costs money, but there are ways that you all could help with that as well.
Yeah, so one of the things that I speak to, the industry for treatment is very challenging because there are agencies that have made it a point from a financial perspective to benefit from this. Our healthcare system was very lucky. We've been able to receive grant funding, and through the grant funding, we've been able to provide these services free of charge to the patient for many years, as well as the Narcan kits, and as well as the access to the groups in the treatment. So yes, we have a program for everybody.
All right. That number, once again, to call is 954-265-4632. 954-265-4632. If you would like to receive the free Narcan, or if you would like to get into rehab and change your life, then you can do so by calling that number 954-265-4632. Don't let anything stop you from doing what you know you need to do. And we would appreciate so much you, Dr. Oxton, telling us about this fentanyl problem that we're having here in South Florida. Going back to just don't take things from people that you don't know, because truly people are, and some people may be doing it just to see how you would react.
Yeah, I mean, I think in the younger population, it's one of those, you're exploring, you want to know, and unfortunately, they have less fear sometimes for some of these things. As we get older, we get a little bit more aware of the risk, maybe a little bit more fear in us. So I think the education is key. But I've spoken to plenty of kids, my own children, and friends and family, and you'll be surprised of how open and willing to understand the risks, and education is key there. So we need to make sure we open those lines of communication with our youth and educate them.
Sounds good. Dr. Alberto Ogston, he is from Memorial Regional Hospital in Hollywood. He's the pharmacy clinical manager and also a board certified clinical toxicologist. Thank you so much for taking the time to give us this important message. And we hope that there are parents out there who will get help for their kids, that maybe there are even some kids watching that want to get help, and adults as well, to go into rehab, whatever your issue may be. It doesn't have to be fentanyl. It could be, as Dr. Ogston mentioned, cocaine. It could be marijuana. It could be alcohol, whatever it is. Give them a call, 954-265-4632. 954-265-4632. Thank you so much, Dr. Ogston. We certainly appreciate you being with us today.
Thank you, Tamara. It was a pleasure. Thank you.
And thank you for watching Good Morning Miramar. Until next time, see you.